Hi everyone, welcome to Dermadry Segments. I'm Amanda and we have Raj Singh with us today. Say hi to everyone. And thank you very much, Dr. Raj, for having us today. We're really happy that you're on board.
Thank you so much for having me on the segment, Amanda.
You're very welcome. So now the viewers and I would love to know a little bit of what you do. If you could explain to us a bit about hyperhidrosis. So we're going to go through a series of questions. The first one is, tell us a little bit about yourself in the field of work.
So you already kind of covered my name. It's Dr. Raj Singh. People always ask me, is that your real name? Because it's a little shorter for like most Indians, but it is. So I'm an internal medicine physician, but I was also specialized in nephrology as well. I like to travel all over the US. My teaching is my passion, so I speak at a lot of medical conferences. I'm also assistant professor at the local university. I got involved in a little bit of social media and recently got the YouTube bug, so I've been working on promoting my YouTube channel also a little bit. So I've been in practice for about 12 plus years now.
Wow. And how did you first become interested in this field of medicine?
so, so I wish I had a more interesting or motivational story like a lot of doctors do. I don't. I always wanted to be a mechanical engineer. However, my sister was in dental school, and my dad told me, "You're going to med school." So I packed my bags, and at age 17, I went to med school in India. Of course, later moved to the United States, went for residency in internal medicine, and later on nephrology fellowship at University of Kansas. So that being said, I'm a relatively young guy at age 41, and although I wanted to be a mechanical engineer, however, I love what I do every single day and the pleasure it brings, of course, taking care of patients. But I always wish I had a very inspiring or motivational story, but I don't.
Well, that's still a wonderful story. There's plenty of viewers asking about hyperhidrosis, and now speaking especially that you are in Las Vegas, what was your first experience dealing with hyperhidrosis patients in your area?
So when we started our practice initially a few years back, we were like seeing maybe 1 to 2 patients per month. But as the word is spreading, as we are seeing, we are more having more patients coming. That being said, my first experience, I remember this. There was this very young girl, probably like in 20 years old. She was very uncomfortable having this conversation with me, would not make eye contact, always kept looking down on the floor. So it took a while for her to kind of get comfortable and actually start addressing some of the issues. So she was very embarrassed about the excessive sweating. She also had some issues with some body odor. So that was my sort of my first experience. And I realized that, how uncomfortable it can be for patients to kind of come to our medical office and actually discuss this because they feel like it's such a taboo topic. Although it is a medical disease, I think we're such a judgmental society that the pressure to look perfect and be perfect, it makes it equally hard. So that was my first experience. It kind of left a mark on me that how distressed these patients are when they
Mm-hmm.
suffer from this. Yeah.
Mm-hmm. And that's something that we are also dealing with. And the ones that come to us, sometimes we get to have that open conversation with them, and they really, they're very kind of unsure and if they're comfortable of speaking about it. And then we're saying, listen, it's just a safe space. And we're happy that slowly but surely there's more advocacy coming in. So we're really excited to hear that people are open to speak about it. And when it comes to now age groups, do you find that there is a specific age group that has more hyperhidrosis, if you want to say, versus, for example, teens and adults? And does hormones come into play?
So we are a internal medicine practice. We only deal with clients that are 18 and older. So I don't have any experience in the pediatric side of things. Most of our clients are young females, generally typically in the age group of about 20 to 28.
Mm-hmm.
Although the condition is equally common in men and women, but we see more females as our clients because women are more likely to seek care than men. And I think part of that is because I think it's more acceptable to be a male and sweaty than it is for women. So there is a little bit of gender bias there.
Mm-hmm.
So a lot of my clients are women in their like 20s.
Mm-hmm.
That's what I see.
And for now, when it comes to the outgrowing of hyperhidrosis, do you think that they might outgrow it when they're in their young adult years?
Unfortunately, not. Once you are diagnosed with hyperhidrosis, it is a genetic disease. It has a familial component. So once you have it, unfortunately, stays with you
Mhm.
for the rest of the life. That being said, once we identify it and as time goes by, our clients become more comfortable in managing their hyperhidrosis. So it's
Mhm.
much more distressing when you're young because you don't really know what to do with it. But as you learn more about it, as you educate yourself, educate those around you, I think it becomes easier to handle and easier to manage as we become older. But yes, the disease does stay with us till we die.
And now, do you find that there's a difference when it comes to which area that they're suffering from hyperhidrosis?
So I mean, if we're talking about primary focal hydrosis, most of the symptoms initially would be on the palms, under the armpits or axilla, and also the soles. So that's the most common presenting symptom. Most of the clients, initially, at least in their childhood, they tend to have more palmar hyperhidrosis than any other area. There are rare varieties, some craniofacial hyperhidrosis also, where we sweat on the face and on the scalp. But the most common presentations tend to be in the palms, the soles, and the armpits.
Mm-hmm. And now we know that there's multiple different treatments when it comes to hyperhidrosis. We would like to know what are your thoughts on tap water iontophoresis like Dermadry as a treatment option for hyperhidrosis?
So tap water iontophoresis works well. Now, this is not a new treatment. I mean, it has been
Mhm.
in existence since the 50s. So that being said, in the past, I was not very comfortable with iontophoresis because the devices were kind of clunky, they were bulky with huge trays, and not very reliable. But with improvements in technology, iontophoresis devices like Dermadry, they're so compact, so easy to manage. So I think it's a very good option for treatment of hyperhidrosis. You can do it at home. It's way more affordable, provides really amazing results. If compliance is good, actually sometimes 100% of symptoms go away for hyperhidrosis or maintaining a good regimen. So not everyone benefits from tap water iontophoresis because you need to maintain a schedule and you need
Mhm.
to be good at following the routine.
Mhm.
So it's not for everyone. For those who use it properly, it can be very, very helpful.
Mhm. And as you were saying, it has been around for years now. And we know that there's so many clinical studies. Are there any clinical studies that you're familiar with when it comes to iontophoresis? Just that's a question that comes up a lot from the viewers.
Yeah, I mean, like I said, the device has been since the 50s, so there is a ton of clinical data, and there's a lot of randomized double control trials. So those are the best studies we like to look at is a randomized control trial. And I mean, there's new data coming on every single year. I looked at so many different studies. The success rate for iontophoresis can be like, in upwards of like 90%. And
Mhm.
some studies actually show that it was up to 98 to actually 100% effective. So it's a very good treatment, and I highly recommend it to our clients. Like I said, not everyone is a candidate for iontophoresis because
Mhm.
there are certain other issues we look at, but it works for a majority of people who suffer from primary focal hyperhidrosis.
Mhm. And yeah, so the device itself is recommended and it is safe to use. However, when do you specifically recommend using iontophoresis treatment, like Dermadry, for example, to your patients?
So Dermadry or tap water iontophoresis is effective for anywhere from mild to moderate to severe hyperhidrosis, but they need to have primary focal hyperhidrosis. So there
Mhm.
are general hyperhidrosis also, which is the body sweating all over. So it does not work for those areas. Of course, it will not work for someone who has craniofacial hyperhidrosis because there's no electrodes that you can put on your face or the scalp.
Mhm.
So for those, we use more topical treatment. For everyone else, this treatment works really, really, really well. And during our medical consultation, of course, we look at the symptoms when they got started. We
Mhm.
look at what they do for work. So I am in Las Vegas. So I have some patients who are frequent travelers. So they are taking the flight from here to there, and then so they're traveling constantly. So for those, they say, well, I prefer that if I come to you once every couple of months and just get the treatments in your office. That works better for my life schedule, but that's just a minority of our clients.
Mhm.
Majority of our clients, 98% or higher, they prefer to do the treatments at home because it doesn't take that much time. You could be watching TV and doing this, and it's also something to do. If I do something in the privacy of my home, I think it's just much more comfortable, and the results are really good. Again, following a regimen, following the instructions on how to use the tap water iontophoresis, I think is very important. So I see a lot of people will actually use bottled water because they'll say, I'm drinking bottled water, so I can put that there. I'll tell them, no, you cannot do that. You need some minerals for this to work. So add some salt if you don't have access to tap water. Because the thing, well, tap water is not good for my drinking, so how can I? So there's some education part that still needs to go in there. But overall, I think it's a really good treatment. We recommend it highly during our medical consultation procedures.
And that's actually a very great tip. I was speaking to someone from Hong Kong actually, and she was saying that the water was kind of, it wasn't working. The minerals it wasn't working at all. So we told her to add maybe a pinch of salt, and the treatment started working perfectly fine. So it's good to give them also tips and tricks depending on where they are located.
Absolutely. Yeah. I mean, if they're not using the device properly, they're not going to see results. And I think that's one of the common mistakes I see is adding bottled water instead of adding the tap water.
And thank you very much for that point. And moving forward now, what should your patient expect when it comes to the treatment of iontophoresis?
So like any new treatment that we introduce into our lifestyle, it has a little bit of a learning curve. So first, it does take a while to kind of get used to and adding this to your regimen at home. So I would say don't be distressed or stressed, but it's easy to do. And once you follow the proper instructions, now initially there is a protocol that you have to follow a couple of times, up to 2 to 3 times a week, depend again on whether you have mild to moderate to severe hyperhidrosis. But afterwards, the frequency of treatment goes down and maintenance regimen. But initially, yes, you will have to do more frequent treatments to get the desired results. But that's what I advise. So just stick with it, follow it on a regular basis, and you will see results. And it's so much easier to add it to the schedule once you get comfortable using. And it's such a small kit to actually, even if you're traveling occasionally, it's okay to just put it in the briefcase and just take it with you. So it works really well. But like I said, there is a little bit of a learning curve, and a lot of our clients, like I said, they are young. So I was pretty stupid when I was in my 20s, and I didn't want to do any of those things. I mean, as teenagers, or we just are, less compliant. We have too many things going on, but the compliance can be an issue. But if you follow it on a regular basis, yes, the side effects are minimal. There is a little bit of learning curve. You feel like a little gentle feather kind of touching the palms, but otherwise very comfortable treatment to do at home.
Also, what's very important is that, like you said, there are little tingling sensations. It's very important to note that everyone's sensibility is different. So it's also very important to keep that in mind when doing the treatment. But there was a question coming up from the viewers, and they were asking, for example, if they are treating one area, does that necessarily mean that they're going to be sweating from another area?
No, it does not work like that. So there will not be increase in sweating in other areas just because we're blocking the release of sweat from these glands in the palms of the underarm. So there is no compensatory increase in sweating. So I think that's just a myth, and that's not scientific guess. So there will not be increase in sweating anywhere else just because you're using this treatment.
And another question comes up. They ask, how do I know if this iontophoresis treatment is the right one for me? What are your thoughts on that?
So I think we determine that based on during our consultation. So although it has a genetic component, but there are certain things that can make it worse. For example, a lot of these patients can have anxiety or sometimes increased sympathetic tone. So we kind of look at, their age group, what they do at home, how comfortable they're going to be managing something like this at their home. So it's all part of the consultation process. And that's how we determine, whether they are, but majority of patients are good candidates for tap water or iontophoresis. So I don't see any obvious contraindications unless you got pacemakers and all those things, but those are not really common in the younger age group. It's a good treatment for a majority of patients, and I would say that everyone in my book, is a candidate for iontophoresis, we recommend it. But if they feel like they cannot follow this or they have some other issues, then yes, there are other alternative treatments also. But we generally do recommend this as one of the good options for that can be done at home.
Now we know that Dermadry is not really prescribed. You don't really need it to be prescribed in other countries. However, in the United States, we do need a prescription. So we know that we do have Dermadry on your website and available at your clinic. So what is the procedure for someone that would be interested in buying a device through you?
Thank you. So, Leah, like you mentioned, so in the United States, you do require a prescription. It can be reimbursed by your insurance, also to some extent, but we do require a consultation. The consultation can be virtual, so we can do it over telemedicine, or it can be through our office, and then a prescription is given, sent to the manufacturer. So if someone has to buy it from our website, they can do that, but before a device is sent to them, we have to do a consultation. And the reason behind requiring a prescription is we want to make sure that they are good candidates for iontophoresis, and it is going to work for them, and it is going to match their expectations. And so a lot of education kind of sort of goes into this as well. So that's why I think it is important that they set up a consultation. It can be virtual or it can be in our office. And then once we feel they're a good candidate for this, we can send them a prescription. They can buy a device from our website or from any other place they require. But a consultation is required in the United States.
Thank you very much for that. What do you wish the public understood more about iontophoresis treatments such as Dermadry as a treatment option for hyperhidrosis?
So I think education is the key. The most important part, I think, initially is educating the public about actually hyperhidrosis, that it is a medical condition, and it's not, and removing some of the taboo and things around hyperhidrosis. So once they understand, once we educate the public about hyperhidrosis and the treatment options, I think a public education campaign that, hey, hyperhidrosis is very common, can occur up to 5% of the population, and there are very effective treatments. So maybe some TV ads, some education component. Education, I think, is the key for successfully managing hyperhidrosis and also the treatment options like Dermadry. Because I'll be honest with you, a lot of patients, although we live in social media environment, a lot of my clients actually have never heard of options like Dermadry or iontophoresis. I mean, all they've been using is some antiperspirants or heard about Botox, but this is such an effective treatment, and they had no idea that something like this exists. So I'm happy to see that actually I see a lot of YouTubers and some social media campaigns going on. More and more people are learning about it. So education, I think, would be the key component, having some public education campaign.
And I think
say like probably hopefully better education in our medical schools and during our trainings, because to be honest with you, I learned nothing about hyperhidrosis during my residency or during my training. I had to learn everything after that, attending some medical conferences, doing my own little research, and from my clinical experience. So I wish this was taught better in medical schools, but it is just not.
And that's something that we're trying to advocate, especially those that do suffer from hyperhidrosis. We want to create a community that it's safe for them to speak about it. Know that we're here to listen. Also, one of the founders, for example, of Dermadry has hyperhidrosis, and that's how the device did come about. And like you said, I think it's the education part of it is very important, and that's why we love speaking to medical experts like yourself and get your opinions and your thoughts and trying to push hyperhidrosis treatments out there. So thank you very much for that. That's a very, very good point.
Thank you.
Moving forward now, there was a question that came in from a viewer asking how effective is Dermadry. So we want to know, with your experience with your patients that have used this type of treatment, what would you respond to that?
It is very effective treatment, and from my experience, I can tell you that the clients or my patients who use it properly have amazing results. But again, like I said, using it properly, that means following the regimen recommended by the manufacturer, using it on a regular basis is the key. So compliance, I think, is the most important. But I've seen success rates, as I say, close to 100%, at least in our practice. But even if you are not using it as prescribed, and we are all human, so we don't like to do these things, right? So even if you miss a treatment in between, still I would say like close to 95% success rate in improvement of hyperhidrosis. For a lot of patients, the sweating issue completely goes away. For a lot of others, it becomes much more manageable. So that means instead of changing their socks 5 times a day, they might only have to do it once a day. But again, if you are following it much more rigorously, like based on the recommendation of the manufacturer, actually, sometimes some studies show actually even 100% improvement in symptoms, and I can attest to that. So our patients had really amazing response. Yes, sometimes if they miss their schedule in between, some of the sweating can return. So it's not an issue with the device or the iontophoresis. It's just more of an operator issue that you're not following it, the instructions, and using it on a regular basis like you're supposed to. We all get lazy.
That's something that we're also trying to understand, that we are in two phases. We do have the treatment schedule and then the maintenance schedule. Depending, like you said, on your hyperhidrosis, if you have mild hyperhidrosis, you might not really tend to need the maintenance as much as somebody that has severe. So yeah, that's something very important. There was also questions that came in speaking about some type of side effects. What are your thoughts on that? Even though we do have they're kind of temporary. What would you answer to that question?
So, I mean, hyperhidrosis is such a distressing condition. So, to me, a little bit of minor side effects or some skin irritation, which can happen sometimes, is not a big concern. Most of our clients have no problem. It is just more getting comfortable to that feeling when you have the hands in the trays or the feet, the little tingling sensation, the little feather sensation. After the treatment, especially if you have very severe hyperhidrosis, so you'll be doing more frequent treatments initially, you might see that the skin is a little bit of dryness. You might see some cracking in the skin, but all of that kind of gets better, but just by applying a little moisturizer after the treatment. So I have not really seen anyone come in and says, okay, this is not working for me and I'm having a ton of side effects, because there just aren't that many. It's just a little bit of skin redness as the electric current is traveling. So that's a normal response. It is going to happen. But they're very, very minor, very manageable. It does not happen in every. So someone who has mild hyperhidrosis, who's using the device on a less frequent basis, they generally feel just fine. If you have very severe hyperhidrosis, initially you might notice more, but as you keep using the device, those minimal side effects, they actually tend to go away, or you don't even notice them. Skin dryness and a little bit of redness is the most common one. Applying a little moisturizer takes care of that after the treatment.
Yeah, and we also do recommend that if somebody feels that there is a bit of redness, what we always recommend is maybe stop the treatment for that week or two, just to give them a bit of a break and then go back. We just want to make sure that everyone is safe on that side as well, even though they are temporary. But that question has came up a few times,
Sure.
so thank you very much for that. Moving forward now, you did give a few tips and tricks, like for example, the socks. Do you have any other tips and tricks for those who do suffer from hyperhidrosis?
So hyperhidrosis sometimes can be associated with bromhidrosis, which is excessive body odor. And once we sweat a lot more, we're not changing clothes more frequently, you can have some bacterial overgrowth, which can cause excessive body odor in addition to excessive sweating. So avoiding certain foods, like garlic, onion, a lot of curries, because they can sort of cause the sweat to be more, more odorous. So having some modification in diet helps. And some clients may also have increase in sympathetic response, so they might have a little bit more anxiety, a little bit more heart palpitations or tachycardia, just because it has some anxious anxiety component as well associated. So doing activities like yoga, meditation, all those things to kind of bring down that sympathetic response, be more calm, be more comfortable, I think helps a lot. Having a good social support structure, I think, is one of the most important. Right? I don't need 500 friends on Facebook. I only need 5 who understand what I have. They have my back. They understand what I'm going through, and I think that is so important as well. Other than that, avoid living in a hot and humid climate if possible. Move away to much cooler places. That helps. Dressing in layers. Cotton is king. Wicks the moisture away. Avoid plastic clothing, things like that. Avoiding too much makeup, because that can clog the pores also between the treatment. So those are some of the things that can also really help a lot.
Thank you very much for those tips. And there's so many more, and I think that perfect aspect when you're talking about even the social support at home or social support through friends, doctors even, I think that's very, very important. Like you said, it is a taboo topic. People are afraid of it, and sometimes people get too anxious to speak about it, and that causes a ripple effect of other issues. So I think that's a very, very great point to bring up.
Thank you.
Another question now. We would love to know, what are your hopes and thoughts for the future when it comes to hyperhidrosis treatments, when in terms of research?
So, I mean, we have way more treatment options for hyperhidrosis than we had, let's say, 20 years back. The Iontophoresis devices like Dermadry, I mean, have improved so much technologically.
Mm-hmm.
We have better understanding of the disease. Public has a little bit better understanding of the disease. The clients who or patients who suffer from this know that they have more options than they did 10 years back.
Mm-hmm.
So I think evolving research, putting more funding into something like this, having much more bigger clinical trials, educating the public, seeing way more treatment options, improvement in devices. So it's an ongoing process. And I think we are seeing, at least my understanding of learning about this is improving as I treat more clients. And adding more education in medical school, that's something I would like to see, so the doctors are more trained in managing something like this. We're educating the public, but we also need to educate our medical professionals who actually take care of. So that's something I would like to see more money spent into research trials, educating more of the physicians who are coming out from the pipeline.
And before we do end off, do you have any questions or thoughts that, or any unique experience that you would love to share with the viewers out there?
I have a lot, but but when it relates to hyperhidrosis, what I would like to end up with is that we're not perfect. None of us are. At least I'm not. I have plenty of flaws. So consider hyperhidrosis also. So the same way. It's a medical disease, and there's not something we can do about it. So you have it. So first thing is acceptance. So accepting that yes, you have this issue is the first step, and then understanding how to manage it would be the next step. Finding a provider who is not dismissive and who actually has experience managing hyperhidrosis would be very, very important, because they can be really a partner who can kind of educate you and guide you on how to better manage your disease. Having a good support structure, I think that's very, very important. So, and just I think acceptance, once you accept that there is something and I have a medical disease, lowers the anxiety level down significantly. So that's what I would say. Just where none of us are perfect, so we don't have to pretend to be. Just acceptance is the key.
Thank you very much, and that was beautifully said. And I think that's a message that's very important for the viewers out there. And please don't be afraid to reach out to any of us if you want to speak about hyperhidrosis. We're really interested in hearing your thoughts, and we would love to help you. So that's all for today's episode. Thank you very much, and we're looking forward to speak to you soon.
Thank you. Bye-bye.